Thank you for choosing UCS Healthcare. We will assist you in identifying and building upon your individual strengths and help you in choosing services that you find useful in promoting your long-term health and recovery efforts. Our treatment plans are patient-centered, and we invite you to be involved in the design of your plan. We are here to help you, and the success of treatment depends on you and your investment. Recovery from any health diagnosis such as substance use disorder, mental health issues, or disease is a long-term commitment and requires long-term support. We are happy to work with every individual regardless of their abilities or challenges. Please notify our staff if you desire special accommodations. In this video, we will cover the following topics: what we do here at UCS Healthcare, your role in treatment, and how your treatment plan is developed and implemented. Before we get started, let's talk about expectations and guidelines. This orientation covers the basics, but is not intended to be all-inclusive, as policies may change and may not provide a detailed explanation of all policies and procedures. If questions remain after this presentation, please consult the handbook you were given, treatment staff, or another member of the team, or visit our website at ucsonline.org. Okay, let's get started with some basic guidelines. Starting with, when is treatment available? How will I know if UCS Healthcare is open or closed during bad weather? First, we are closed on Sundays and major holidays. Holiday hours are posted well in advance. If a closure is necessary due to weather and/or crisis, we will post that information on our website and our social media channels. Always call in advance if you're unsure about our hours or weather situations. If you are experiencing an emergency, call 911 or go to the nearest emergency department. UCS Healthcare has an answering service for crisis issues after office hours. This can be reached by calling 515-280-3860. What are the behavior expectations of the UCS Healthcare program? Put most simply, show respect and be polite. We expect courteous and considerate treatment of our patients and staff at all times. Treat others with respect and dignity, just as staff and peers within the clinic will treat you. We are committed to an atmosphere that is positive and affirming, free of tension, harassment, or inappropriate comments and behaviors. Attendance. Repeated unexcused absences will be addressed accordingly in order to ensure that you are getting what you need out of your treatment experience. Zero tolerance policy for violence. Any threats towards you or others will be taken seriously and addressed immediately. You will be asked to leave the office immediately. The police may be called for support. Unruly, obnoxious, boisterous, vulgar, or other disruptive behavior, whether chemically induced or not, is prohibited. You will be asked to stop this behavior or leave the premises. The police may be called for support. These rules that are in place for the safety of our patients and our UCS Healthcare staff. We serve adults, adolescents, and children. It is your responsibility to report if you are a registered sex offender and follow any and all restrictions in place. If you have been convicted of a sexual offense, this does not exclude you from receiving services. Use of illicit drugs and licit drugs used illegally are prohibited on our property. Weapons are not allowed on property. This includes firearms, pellet guns, or other weapons including sprays, stun guns, knives, etc. In addition, please note the following. If you have a medical emergency or threaten to harm yourself, your treatment staff member will call your emergency contact and/or emergency personnel. No tobacco use, including chewing tobacco, shisha, nicotine gum, vaping, and green cigarettes within facility or on grounds. In order to maintain cleanliness in the common areas and group rooms, food and drink are not allowed. You may bring a water bottle with a cap. Notify staff if you have a concern regarding a spill, damage, or other potential safety risk in these areas. Cars left overnight at any UCS Healthcare location will be towed at owner's expense. If you are having car trouble and the car must be left overnight, please let the front desk know or the car will be towed. Now that we've established the guidelines and expectations, let's move on to treatment. During the intake process, you were provided with a handbook and signed several documents. To review, here is what you signed during the intake process. Acknowledge that you received the handbook. Consent to participate in treatment. Releases of information. If you would like a copy of your consent to participate in treatment or releases of information, please ask your counselor. Now that you are enrolled, how will treatment work? You completed an assessment. A counselor has been assigned to you. You and your counselor will develop an individualized plan, will discuss and agree on type and frequency of services. Long and short-term goals will be established. The treatment plan will be updated and reviewed with you on a regular basis. As your goals and objectives are accomplished, you will begin discharge planning with your counselor. We encourage family and significant others' involvement. UCS Healthcare wants our patients to know one thing. You will not be denied treatment for financial reasons. We will work with you to find a feasible solution. Different services at UCS Healthcare have different fee structures. You likely had a discussion of your fee structure and funding upon admission into any services. You may be asked to provide proof of income, a recent pay stub, last year's tax form, etc., and proof of number of dependents before and at random times during your treatment. If you are uninsured, please talk to the front desk or your counselor on how to sign up for Medicaid. If you meet eligibility criteria for your treatment to be subsidized by the state or federal government, and the calculation is higher than 10%, you can request a financial hardship. Please ask your treatment staff member for the financial hardship form. You are expected to pay for services. Remember that any paperwork you may need from UCS Healthcare will not be provided until appropriate financial arrangements have been made. What if I don't meet behavior expectations? We will work with you to make changes in your treatment plan and avoid dismissal from the program if problems arise. You may be dismissed from the program if it has been determined that your conduct is adversely affecting others and remains unchanged. Issues leading to discharge from programming may include, but are not limited to, attending group or individual sessions under the influence of drugs or alcohol, continual disregard of your treatment plan and goals, not keeping appointments as agreed upon in your treatment plan, continued illegal use of substances. This criterion alone is not sufficient for dismissal. Repeated failure to take medication as directed. Selling or purchasing drugs on UCS Healthcare property. Conduct which adversely affects you, other patients, or UCS Healthcare staff. If you are dismissed from the program, UCS Healthcare will work with you to make an appropriate referral to another program within the area. What are my rights? Your rights are very important to us at UCS Healthcare, and we want to make sure you understand what you can expect. These rights are posted throughout our facilities. We will also review these with you when you start treatment and at a minimum on a yearly basis if you are still receiving services at that time. You can also review the patient rights statement on our website at any time. At UCS Healthcare, we take confidentiality very seriously. For the protection of confidentiality, you are not allowed in any private office or administrative area unless a staff member is present. You are expected to adhere to confidentiality and understand that what you see or hear within the facility stays in the facility. There are legal penalties for breaking confidentiality rules. Generally, no information is released without your consent. The exceptions are: you sign a written release of information. A court order or other mandated report allows the disclosure. There is a concern of child abuse or dependent adult abuse. There is a crime or threat of a crime committed at the program or against a staff member. The disclosure is made to medical personnel in a medical emergency. The disclosure is made to qualified personnel for research, audit, or program evaluation. Most importantly, what you see in group therapy sessions or in the clinic, what you hear in group, stays in the group. If you feel that your patient rights have been violated, we have a grievance and appeals process. Grievance is defined as a perceived violation of a patient's rights. You have the right to file a grievance relating to your perceived violation of patient rights. The first step is to talk to your treatment staff member. Second step, if you continue to be dissatisfied, the next step is to submit the grievance in writing to the clinical director. The grievance form is on the website www.ucsonline.org, or you may obtain the grievance form in the lobby of the main office suite. Any staff member can assist you in completing the form. You will receive a written response within 10 working days of receipt of the grievance. If you are dismissed from the program for misconduct, you may appeal this decision through the grievance procedure. Your grievance will not result in any retaliation or barriers to services. This appeal and results will be recorded in your file. You don't have a grievance, but you have a complaint, a comment, or, this would be great, a compliment. We want to hear about it. Each location has suggestion and complaint box that you may use for suggestions or complaints. You may also go on the website www.ucsonline.org to submit complaints or suggestions. If you would like a response to your suggestion or complaint, please put your name on the form. What is the difference between a complaint and a grievance? A complaint is usually environmental, that we do not allow coffee or food to be brought into the clinic, or hours of operation, or that you don't like what's on the monitors in the waiting room. A grievance is when your patient rights have been violated. This has more to do with your treatment or the staff providing services to you. If you have questions, be sure to ask UCS Healthcare team members. So you've completed services. What happens now? Once you've completed services for substance use disorder, please know we still care about your recovery. UCS Healthcare, in conjunction with the Iowa Consortium for Substance Abuse Research and Evaluation, may complete follow-up calls and/or written correspondence to ensure your well-being. On a periodic basis, you will be asked to provide patient feedback through an online survey or through our website, www.ucsonline.org/patient-feedback. Please take the time to fill out this survey. All information is reviewed and utilized in making changes to services to better meet your needs. Personal information obtained from follow-up surveys is confidential and will not be shared with other personnel or entities. What if there is a crisis? If you are in an intoxicated state while at UCS Healthcare, you will not be allowed to leave the building. Staff will assist you in notifying a friend or family member or appropriate authorities to escort you home if you are unable to get there safely on your own. When you're at UCS Healthcare, your safety is important. Please be aware of these safety measures. Emergency exit signs and fire extinguishers are located through the building. You will be instructed and assisted in leaving the building. Do not risk extinguishing a fire that is out of control. If an emergency arises due to an explosion, you will immediately vacate the premises. You will be instructed to go to a designated meeting spot to seek safety from fire or explosion. Controlling bomb threats. If a suspicious-looking material is found on the premises, notify staff and evacuate the building immediately. Any threat or perceived threat will be taken seriously and treated as so. If you feel threatened by anyone, please notify staff immediately. Tornado, flood watches, warnings, and dangerous weather conditions. Staff will continuously monitor changing weather conditions. If a weather warning is in effect, you will take immediate shelter in the designated facility areas. Again, thank you for choosing UCS Healthcare. We know you have choices about your healthcare, and we are honored to partner with you in your total health. If you have questions, please visit our website at ucsonline.org or speak to any UCS Healthcare staff member. If you are watching this video segment, it means your individualized treatment plan includes medication-assisted treatment. This segment will quickly walk you through what medication-assisted treatment is, how it works, and what are the expectations. What is medication-assisted treatment? UCS Healthcare utilizes the current federal guidelines for the use of MAT for opiate use disorder and delivers quality care to you and allows you to achieve the maximum benefit from this treatment. What should I know about treatment? The first thing to know is that it will not be easy and you will need to have patience. Medication-assisted treatment works best when combined with counseling services. You and your counselor will discuss and plan your treatment schedule. Medication and counseling work together to provide the best results. Remember, the goal of treatment is to stabilize your body physically so you can make the best of your life. While medication may address the physical symptoms, only counseling can address the behavioral aspects of your treatment. How long do I need to be on medication-assisted treatment? Counseling can give you practical strategies to make your treatment successful, assist in changing negative thinking and behaviors, and help you develop a plan that is right for you so you can continue rebuilding your life. There is no set schedule for completing medication-assisted treatment. However, most people who are successful tapering off medication-assisted treatment show three important characteristics. Your life is generally stabilized. You and the medical team developed a detoxification plan. You have family, community, and peers on your recovery support team. It is important to know medication-assisted treatment is safe and effective when used as prescribed, and you can take medication for years. Abuse of your medication-assisted treatment medications can cause death. Never sell or trade your dose. If you are interested in medically supervised withdrawal, there are some important facts to know. Relapse is a significant concern when conducting medically supervised withdrawal. The implications of relapse and possible risk of overdose should be carefully explained to those who are requesting medically supervised withdrawal. During detoxification, the patient should be closely monitored, offered appropriate psychosocial support, and offered medication maintenance treatment if they become unstable during the detoxification process. There is no absolute standard for how fast or slow to detoxify a patient using Suboxone, but the general guideline is to detoxify as gradually as possible to minimize symptoms of acute opioid withdrawal. What are the drug screening requirements? You will complete an initial drug screening test upon admission to the program. You will complete at least monthly random drug screening tests. Your analysis are required to be completed prior to checking in for dosing. Electronically observed drug screens are required at any time. If you are unable to complete an observed urine drug screen, you have the option to give a saliva sample at the cost of $20, which must be paid in cash in advance of the testing. Saliva tests can't be sent for confirmation. If you complete a drug screening test that is positive for illicit drugs and negative for methadone or Suboxone as appropriate, the treatment team will discuss your situation and appropriate protocol will be applied and documented. You may be asked to attend outpatient or residential treatment. A UA is required prior to receiving your dose. Please arrive in time to give your urine specimen during dosing hours. If you leave and do not return to complete the drug screening test, you will not dose the next day until the UA is obtained. Positive urine drug screens are not used as sole criterion for dismissal from the program. If you test positive for illicit drugs or alcohol or for any prescription medication without an accompanying prescription, you are put on probationary status and may lose take-home privileges. If you are pregnant, methadone is the medication-assisted treatment of choice for the treatment of opiate-dependent pregnant persons. Persons assigned female gender at birth who are of childbearing years will be tested for pregnancy before a detoxification schedule starts or a medication taper schedule starts. If you are pregnant, you are required to meet with a nurse monthly and sign a release of information to your medical team to confirm appointments are kept. When you are using medication-assisted treatment, you and your UCS Healthcare medical provider will determine your ideal daily dose within the first few days of induction. The next few weeks are a stabilization period during which time you will be maintained at your daily dose with close monitoring and adjustments as needed. Regular and frequent clinic visits should continue until you stabilize medically and psychosocially. At an ideal daily dose, you should experience no withdrawal symptoms and no cravings. Take-home doses are a next step in your progress. As you progress toward your recovery goals, you will have an opportunity to begin take-home doses of your medication when you meet the following criteria: absence of recent abuse of drugs, narcotic or non-narcotic, including alcohol; regularity of clinic attendance; absence of serious behavioral problems at the clinic; absence of recent criminal activity, stability of your home environment and social relationships, length of time in treatment, assurance that take-home medication can be safely stored within your home and recommended medication to be transported in a blocked box, and whether the rehabilitation benefit to you in decreasing the frequency of clinic attendance outweighs the potential risks of diversion. Absence of a balance due on account. Correct pill counts if applicable. Medication-assisted treatment, daily dosing expectations. Dosing. You are expected to ingest your dose in front of the pharmacy or medication unit window. Failure to do so may result in you being placed on a medication taper schedule. Crime. Your dose is only for you, the person for whom it was prescribed. Any deviation from this plan may result in you being placed on a medication taper schedule. No urinalysis, no dose. Failure to do so will be grounds for loss of take-home privileges and possible medical taper. At UCS Healthcare, we believe in a harm reduction model, and if you have a misstep in your recovery, we will work with you to help you continue in your recovery. If during your drug screening you have a positive test, we will implement our process for helping you get back on track. First positive urinalysis equals 30 days of daily dosing. Second positive urinalysis, 60 days of daily dosing. Third positive urinalysis, 90 days of daily dosing. Subsequent positive urinalysis, 1 year of daily dosing. It may be recommended that you start the take-home process over, beginning with 1 take-home per week. It may also be recommended that you attend a more intensive level of treatment. You may request verification on any positive urinalysis result you believe is inaccurate. Cost of retesting of drug screens is your responsibility and must be paid at the time of request. There are no refunds for confirmations. The laboratory only holds positive urine screens for a period of 30 days. Saliva tests can't be sent for confirmation. We use a 3-flag system at UCS Healthcare. What does that mean to our patients? If you have missed multiple appointments, had positive urinalysis, or are not making progress towards treatment goals or recovery contract. Flag 1, set by counselor or counselor's supervisor, you'll be required to make an appointment to meet with your counselor. Make sure that you schedule this appointment at a time that you can attend. You will be unable to dose if you do not attend this appointment on this day. Flag 1 is not always needed to have Flag 2 or 3. Flag 2, set by the crisis counselor. This flag will remind you of your appointment the day before. Flag 3, set by crisis counselor. This flag will be on the day of your appointment. You will not be able to dose without attending your appointment. Your counselor will walk you up to dose after the appointment is complete. What if I miss the appointment for flag number 3? If you miss your appointment, you will have to wait on that day for your counselor or the team day counselors to be available to meet with you before you will be able to dose. If you arrive for treatment or an appointment at UCS Healthcare under the influence of any mood-altering chemical, you will not be dosed until meeting with the nurse. The pharmacist or nurse has the right to withhold dosing. The pharmacist or nurse will have a direct conversation with you to help determine your sobriety level. If your sobriety is in question, for your safety, you will not be dosed and you will be given a urinalysis, saliva, or breathalyzer test by clinical staff as appropriate. Due to the increased risk of overdose with co-occurring use of alcohol and opiate replacement medications, you may be placed on a daily breathalyzer for any reason, including reports of alcohol use, positive UAs for alcohol, or suspicion of use. The first time is 30 days daily breathalyzer, then will increase with each positive to 60 days, 90 days, and then lifelong. Breathalyzers will be completed prior to dosing and there will be 1 chance daily. Any positive breathalyzer will result in holding your dose for that day. It is recommended to have nothing in your mouth 15 to 30 minutes prior to using the breathalyzer. UCS Healthcare utilizes recovery contracts to assist you in completing your treatment and recovery goals. If you are struggling with attendance, relapse issues, medication counts, or continued use of illicit substances, you may be placed on a recovery contract. You and your counselor will develop a signed contract stating what activities you will complete to follow your treatment plan and regain your momentum. The recovery contract will last 45 days. You will meet with your counselor at least every 15 days to discuss progress, and you'll perform 2-year analysis. What is a callback? If you receive take-home doses, you may be contacted for random callback of your doses. You must return all unadulterated, intact doses with labels attached to the clinic during dosing hours and within 24 hours of receiving the callback for the pharmacist or nurse to check your doses. It is your responsibility to make sure we have a current phone number to contact you. If UCS Healthcare does not have a current phone number, it is not an excuse for not returning doses, and you will lose your take-home privileges. If you are currently taking prescription medications, please note that all prescription medications must be registered with program staff as soon as they are filled at a pharmacy. The prescription bottle must be brought in to the UA or medication unit desk to be scanned. Lost or stolen prescription medications must be reported to the police. The ability to keep your prescription medications safe has a direct impact on the ability to keep your UCS take-home medications safe. You may be required to sign a release of information for your prescribing physician to coordinate safe and effective care. Failure to comply may result in discharge from the program. UCS Healthcare reserves the right to perform a pill count on any and all prescription medications as part of your recovery process, and as deemed appropriate by the medical director. All required pill counts will be conducted by clinical staff. All prescriptions must be in the original bottle. You have to take the prescription as prescribed on the bottle. Pill count must be accurate in number of days and dosage per prescription. If you have a solid rationale for being unable to report to the clinic with the time parameter given, a recheck reprieve may be granted. During your pill count, all pills must be accounted for. You will not be allowed to leave and retrieve more pills. If all pills are not present for count on assigned day, we may move the count to the following day. After one move, you will sign for 0 pills for that count. Take-homes will be lost if applicable. When prescription is refilled, the bottle must be brought in to be scanned into the system. You are responsible for the security of prescription pickup from pharmacy and maintaining the security of that medication. An example, lockbox, locked cabinet, ID security code at pharmacy. Take-homes will not be granted to those who have incorrect pill counts or lost or stolen medications until staff feels the medications can be kept safe. A minimum of 30 days with correct pill counts will be required before take-homes will be considered. A common question we receive for medication-assisted treatment is, what if I miss dosing? If it is after hours and you have missed your dose, try the following steps to stay focused until UCS Healthcare is open again. 1. Drink plenty of water to stay hydrated. 2. Take Tylenol or Advil for discomfort, Benadryl for sleep. 3. Use a cold pack on your neck. 4. Use a heating pad on your abdomen for cramps. 5. Take over-the-counter medications for stomach upset. 6. Remain calm. Methadone stays in your system for a long time. 7. Keep yourself occupied. Stick with your normal daily routine. 8. Get to clinic early the next day. 9. If your symptoms are too severe, go to the emergency room. Life happens sometimes, and one of these unusual circumstances may happen to you while you are participating in the UCS Healthcare Medication-Assisted Treatment Program. Vomiting a dose. If you vomit your methadone medication while still in the clinic, you must contact UCS Healthcare staff immediately to determine if dose is in specimen. Staff will then inform the pharmacist or nurse, and you will wait in the clinic for 15 minutes of observation before redosing. Redosing will occur at half your regular dose amount. If you vomit after leaving the clinic, you must wait until the next day for your regular dose. There will be no redosing for Suboxone vomited doses. If you lose or have a dose stolen and wish to replace it, a police report must be filed and a copy of the report must be presented to the nurse, who will give it to the staff authorizing a supplemental dose. The first time you have lost or had a dose stolen, you will daily dose for 30 days. After a second occurrence, you will daily dose for 90 days, and if there is a third occurrence, then you will daily dose for a minimum of 1 year, at which time staff will determine if take-homes may be reinstated. Replacing doses. If you have lost, spilled, or vomited your methadone or naltrexone dose and request a replacement, the cost will be $10 per replacement dose. If you have lost your Suboxone doses, you will be charged based on the milligrams. Only cash or credit card will be accepted for the replacement doses. Payment will be required prior to receiving the dose. Again, thank you for choosing UCS Healthcare. We know you have choices about your healthcare, and we are honored to partner with you in your total health. If you have questions, please visit our website at ucsonline.org or speak to any UCS Healthcare staff member.